Ever since she can remember, Penny's legs have been a difference in length. Initially, the discrepancy was small enough to ignore, but later it could be fixed with shoe lips. But this difference only increased over time, and after years of difficulty walking and misalignments in postures, she's now dealing with scoliosis alongside with chronic back and joint pain. Penny is far from the only person with this problem. Differences in leg length can emerge from various reasons, from genetic and hormonal conditions to injuries that impact on the bone growth. But while we still don't know exactly what degree of the difference causes health issues, doctors have made great strides in figuring out how to even dismiss attached limbs. To lengthen a bone, you need to grow a new bone tissue. And a great way to get the bone to do that is to break an existing bone. Within 5 to 7 days of a bone break or fracture, the body will form a fracture callus at the damaged site. Over several weeks, this jelly-like blob of a scalp tissue will solidify to cartilage, and which will harden into standard bone over 2 or 3 months. But with the proper tools, surgeons can control and extend this process, using a fracture callus like a bone printer to extend the limb's length. What doctors throughout the early 20th century attempted to nail, pull, clamp, pin the bones to guide this process. A monumental breakthrough came in the 1850s by the Soviet automatic surgeon Gravity Lizard. He developed a technique called distraction osteogenesis, which began with a controlled bone break called an osteotomy. To do this, the doctor cut a small nick of the skin, through which they cut the bone in a chisel-like tool. Then they hooked a kind of circular frame called a stenofracture above and below the break. The possible fixture allowed doctors to persistently pull the healing bone apart. And the device's modern-day descendants are still used for correcting complex bone determinations. But since the wires and pins puncture through the skin, they often pull on the muscles, scar soft tissues, and create opportunities for an infection. So, when possible, modern surgeons typically rely on more recent breakthrough, implanting the lengthened nails. To see this in action, let's check back with Penny. Her right femur is 5 cm shorter and is quarter apart. To increase this length with an internal nail, the surgeon first takes place with the radiate maker spin, above and below the site of the eventual bone cut. Then they perform an osteotomy, and the surgeon threads the nail through the broken bone, securing it on both sides of the cut before removing the rotation markers, and finally closing the skin. Once the fracture callus forms, the nail can get to work in one of several days. Some allow patients to twist the leg back and forth, or rotate the gears along the track. Others have a controller that can gradually extend the nail, either via a cord radiated through the skin or a wirelessly controlled magnet that rotates the gears inside the nail. In a given day, the bone is gradually lengthened several times, and rarely exceeding 1 mm daily. This low speed is essential, both for the bone formation and the nearby soft tissue. Since our bodies can't make new muscle or nerve cells, the limb lengthening requires our existing cells to stretch. And if they stretch too quickly, it can lead to joint tightness or nerve pain. Once the desired length is reached, the new bone is left to heal and solidify. Like any surgery, bone lengthening has its risks and limitations. In the rare cases, unimplanted nails can break, require further surgery to remove or replace. And when limb length differences are especially large, patients may require multiple surgeries. But the biggest limitation are access and awareness. Since this technology is new, the surgery can be expensive. And many doctors and hospitals yet don't have the tools and expertise to performing the lengthening surgeries. But hopefully it won't take long for these surgeries to become accessible for people from all walks of life.